Hypoglycemia is also known as low blood sugar. It's relatively common in diabetics as a side effect of medication, both pills and insulin. Patients who have hypoglycemia have below normal blood sugar, which can cause nervousness, sweating, confusion, and dizziness, to name a few. Early recognition and appropriate treatment of hypoglycemia is an important part of your diabetes management plan. Hey Brad, how you doing? How's the diabetes?
Well, I've been taking my medicines just like I'm supposed to, but sometimes I get real jittery afterwards.
Well, that could be hypoglycemia.
You mean low blood sugar?
Yeah, well, patients like you with diabetes can get low blood sugar if you're missing a meal or snack, or maybe exercising a little bit more than you're used to.
I have been working out in the yard a little bit more.
Well, that certainly could be a factor. It could also be due to your medications. Did you bring them in today?
Yeah, I did. I have them right here.
Well, it's important to bring these in every visit and, of course, take them exactly as I prescribe. And again, make sure you don't miss any meals or snacks because all of that can contribute to low blood sugar or hypoglycemia.
How do I know my blood sugar's low for sure?
Well, you want to check with your meter the same way you usually do.
You mean I can use this one?
Yeah, exactly. Yeah, if your blood sugar goes less than 70 and you're feeling any of those symptoms, you want to use any one of these following options to bring them up. Drink a small glass of any fruit juice or even a regular soda. Drink a larger glass of milk. Suck on 5 or 6 pieces of hard candy or caramels. Take 1 tablespoon of sugar or honey, or if you're out and about, you could take 3 or 4 glucose tablets. You can get these at the drugstore. So you want to recheck your blood sugar every 15 minutes to make sure it's above 70. And if it's not, if it's below 70 and you're still not feeling right, repeat any one of those quick fix steps.
That sounds easy enough. Do you want me to write these down in my logbook?
Oh, absolutely. Tracking and appropriately managing these episodes of hypoglycemia is really important. We went over a lot of stuff today. Why don't you teach back to me in your own words what we went over?
Okay, hypoglycemia or low blood sugar can make me feel really nervous or tired. It's caused when I skip meals or snacks or if I've been more active than usual. I really need to make sure I check my sugars when I feel this way. If they're under 70, I need to make sure I get something really sugary and sweet to eat or drink until it's over 70. And want to make sure I record all that in my logbook. I want to make sure I bring my logbook to every doctor's visit and make sure I take my medicines as prescribed.
Absolutely, you got it. Now there's one last thing. If you have an episode of hypoglycemia that is so severe that you need the assistance or help of your wife or a coworker to give you something to bring your blood sugar up, you need to call me immediately because that's very serious and I may need to adjust your medications right away.
Well, absolutely I will do that.
Great. Hypoglycemia can occur anytime. It's important to have a quick fix remedy at home, in your car, and at work. Recognition, monitoring, and appropriate treatment of hypoglycemia will help you safely manage your diabetes. I'm Dr. Duran Schneider, and this has been another tip to help you live a healthier life.